I'm Yoshimitsu Soga from Japan. I'm working in the Kokura Memorial Hospital. I'm an interventional cardiologist. I'd like to introduce the POPCORN Registry, which is the largest prospective multicenter observational Japanese DCB registry. 81 institutions were enrolled in this study. More than 3,000 lesions were registered to verify the new findings from Japan. Japanese situation and the vascular situation is a bit different from the Western countries. So we do not use a bailout stent. We do not have the various atherectomy device. So also high rate of the IVUS usage. So we need to investigate the Japanese data. Therefore, we started the POPCORN Registry. I believe that this data is very helpful and useful in our daily practice for fan population. The primary endpoint of this study is a 12-month primary patency, but subgroup analysis shows us the difference of the two types of DCB, Lutonix and IN.PACT. This registry includes only two kinds of DCB, IN.PACT and the Lutonix. To compare these two DCBs, the primary patency was significantly higher in the IN.PACT Admiral high-dose DCB. Also, freedom from TLR was also significantly higher in the high-dose DCB IN.PACT compared to the low-dose DCB Lutonix. In clinical setting, high-dose DCB is very useful to keep the patency to avoid the restenosis or reintervention. Therefore, so risk stratification is very important if we can choose the two different DCBs. For high-risk lesion, high-dose DCB is more effective from this registry, I think. Unlike a Western countries registry, so Japanese registry shows the very different patient and the lesion background. The first is a more elderly patient was enrolled. The mean age was 74, higher elderly. So also non-ambulatory patients were also enrolled, maybe around 13%. The CLTI was 32% in this registry. The CTO was 26%. The mean lesion length was 13 or 14 centimeters. Interestingly, IVUS usage was pretty high, 73% in this registry. Therefore, so we usually choose the optimal balloon size by measured by IVUS. It's a very interesting result. So I already reported the 1-year clinical outcome from JAHA last year, but in the LINC, we also reported that 2-year result, the more longer-term result from POPCORN Registry. The POPCORN Registry shows us the clinical risk factor, the independent of the risk factor of the 1-year restenosis, such as a history of EVT, the smaller vessel, severe calcified lesion, CDO, the low-dose DCB, and the residual stenosis. These 6 independent risk factors for 1-year restenosis was affect to the longer term from this registry. Therefore, I emphasize that the POPCORN demonstrate that the 6 risk factors of the restenosis and effect in the chronic phase. So before using the DCB, I personally believe the DCB is a perfect device. So also leave nothing behind concept is ideal. But in a clinical setting, in a daily practice, uh, it, it's not perfect in all cases. Therefore, risk stratification is very important to choose the optimal patient, to choose the optimal lesion for the DCB. Call is a good outcome. Therefore, so high risk or more complex lesion, so we sometimes start considering to put a stent, not too depending on the power result. We think the two-step, the first, more longer-term follow-up is needed. Only 1 or 2 year results present in the LINC, but longer-term effect is needed. Other DCB devices also enrolled in this registry. The actually Ranger DCB from Boston Scientific will be start. It's called POPCORN Type R. In the near future, we'd like to compare POPCORN with POPCORN Type R. So furthermore, the other new DCB will be approved in near future in Japan. So at last, we'd like to compare among the various DCB, which is better, which is not better from the POPCORN registry.